Hi, I'm Gary Bebow, CEO of WRHS System, and this is my May CEO Connection. I'm really pleased today to have Boris Dover with me as my guest. Boris is our chairman of the WRHS System Board of Directors. He's been on the board since 2003 and became chairman in January of 2016. He's served in several different capacities on the board over those last 14 years. As a building committee chairman and other committees as well, finance committee, and boy, it's been just an invaluable source of being on the board. I've really been fortunate over the years to have excellent chairmen. Boris, of course, most recently, and then the ones prior to him, each of them have been just terrific in serving and giving up their time and talent to really allow this organization to progress forward. So Boris, first of all, thanks for serving on the board, and
thank you. And thanks for the invitation to be here today.
We're delighted to have you here. Tell me a little bit about your tenure on the board, and as the chairman, what kind of comes to mind as you're serving?
Well, of course, I'm a native of Batesville, and after graduating from ASU, my family moved back and became involved in the local bank. At the time, it was First National Bank, and so as I began to be involved in the community, I always recognized that the hospital was such a critical employer in quality of life issues that helped in economic development. So I've always admired the hospital. I remember when when I lived here growing up, this was just a vacant piece of property. So to now see what facilities that we have here and the physicians that you have attracted and just observe the growth of the hospital, it's been a phenomenal success story for our community, and one that I know other communities are envious of our size. But I was very honored to be asked to serve on the advisory board, I believe, in the very beginning, and served don't remember how long, but then had the opportunity to join the full board, and I just enjoyed my experience here and watching the hospital grow and just see how important from now the major employer in our region, and just the economic impact and the quality of life issues impact it has. So we're very, very fortunate to have the White River Medical Center and Health System here.
Well, you've been really instrumental in some of the progress we've made over the last 14 years. I mean, as part of the building committee, you oversaw this east pavilion built in the 2011-2012 time period.
And I have to say that was one of the easiest projects that we probably have had. I mean, that Clark Construction, I believe, did that, and I think the superintendent we had on that job just did a phenomenal job. And there's always disruption when you have that kind of major expansion going on in your business, but I thought it went off without a major problem. So
no doubt. And then even now, having served as a chairman, you've been involved in the residency program that we're about to kick off in the next few months, and I know you played a major role in that. And
well, thank you and your administrative team for the leadership y'all shown for our board and for our expansion of our hospital. I think, as you said, that residency program is going to be life-changing, life-altering for our community and our region. So I think, and just all the expansion and bringing, you remember how many physicians were here when you came, and now we're 75 to 100
well, actually,
physicians.
Yeah, we got about 100 now on the medical staff at White River. Yeah, when I came, we had 27, and so we've added a few over the years.
Yeah.
But the community's grown, and I think just the economic benefit to Batesville from the hospital has been has been significant over the last 25 years.
It's like I say, been the largest employer for a number of years, and good paying jobs, and the number of jobs that the number of individuals you employ it's very critical to our economy. So very proud to be associated with the hospital and watch that growth and the quality growth that we've had.
During these uncertain times with healthcare reform and the changes in reimbursement systems and all the things that are happening in terms just the quality of care, the evidence-based medicine, and so on, it's really important to have solid board leadership like you, and so I really appreciate that.
Thank you. And I've always felt that, and I think the hospital's had for the last since I moved back in '81, and since you came on board as CEO, I think think we've had a great leadership from the board, a cross-section of people from the community to be well represented, and I've always admired the dedication of the board. Before I joined and since I've joined, as we brought in new board members and had some retire, and so I know that I know they've all feel like I do, that it's worthy to spend our time that we do serving on the board.
Well, it's really been my pleasure to work with everybody. I appreciate you coming in and spending this time with us today. And people that are watching this video have a better idea of you and what kind of quality leadership we have in the board. So,
well, as I told you, believe it or not, I watch these each month when Michelle sends these, and I find those very informative to know what's going on. And as you feature your employee of the month or employee of the year, I think that's good information for the board, and I know the employees appreciate hearing that from their leader and knowing what's going on in their organization. So, thanks for doing that.
Thank you.
Taking the time.
Thanks for coming in. Got two employees of the month that I want to recognize. First one being from Stone County Medical Center, Rachel Everett, who's a lab tech. She's being recognized for her great work ethic, and she's been employed at Stone County Medical Center for 2 years. At White River Medical Center, Sissy Ford, an RN in our cardiac cath lab, has been named as Employee of the Month. She's been recognized for demonstrating the standard of behavior involved, and she's been employed at White River Medical Center for 26 years. Both Rachel and Sissy are great employees, and if you see them, please recognize them for their being Employee of the Month. I have a couple of announcements regarding physicians at White River Health System. First being as our new emergency department management team, led by Dr. Skip Baker and Dr. Danielle Wallace. They've taken over responsibility for the White River Medical Center's emergency room on April 1st. I've been tracking information regarding patient satisfaction and length of stay in the emergency room, and just employee morale and the like, and boy, Dr. Baker and Dr. Wallace, they're really doing a great job, and that whole team is doing a super job in emergency room, so I'm really pleased to have them on board. At our Newport clinic, we have Dr. Melissa Yon has joined Drs. Lawson and Hunt as family medicine doctor there. Prior to joining our staff in Newport, Dr. Yon practiced in and around the Jonesboro area, so we're really pleased to have her join us in Newport. I wanted to give you an update on the White River Health System employee bonus plan. We've made some minor changes. One thing that stayed the same is that one of the two components of the plan is White River Health System operating income, and that's the same as what we've had in the past, and that represents 50% of the total award. The thing that's changed is we've moved patient satisfaction from being a facility by facility attribute. We've changed it to having a one White River Health System patient satisfaction, where we bring all of those different patient satisfaction from Stone County Medical Center and White River Medical Center to have one metric. And so as we do as a system, that's how the employee award will be given. So more information on that, best you can find that out from your director so they can explain it as well. But overall, pretty much similar to the past. The only difference is that we're not going to separate patient satisfaction by the different facilities, and so frankly I think it's better. It allows us to look at ourselves and be viewed as a system rather than by each facility, so I think it's a good thing. Each year, White River Health System celebrates National Hospital Week, and this year it's from May 7th to May 13th, and during that week we'll have a number of celebrations going on, including picnics and gifts and other things like that. And so first of all, let me recognize each employee for their contribution that makes this organization a great one. And let's all get together on May 7th to the 13th and celebrate National Hospital Week. Recently, the White River Health System Board of Directors approved a long-range strategic plan that will guide us for the next 3 years. A part of the plan is to evaluate our mission, vision, and value statement. And after a lot of study and consideration, it was decided to change our mission statement to read, "The mission of White River Health System is to provide quality health care and improve the health of our communities." You know, shortened, succinct, and yet I think very meaningful to what we should be looking at as a part of our mission, and let it guide us in our behavior and how we represent this facility in the future. So a new mission statement. So read it and think about yourselves, and let's do our best to support it and to further it in the future. That concludes my CEO Connection for May. Again, thanks for watching, and if you have any suggestions on how it can be improved, please let us know. So have a great May.